Tower Hamlets is home to a diverse population with many different spiritual, moral, social and cultural needs. The provision for healthcare is a requirement for all of its residents, including those who are terminally ill and who are reaching the end of their lives. Caring for those who are critically ill has always brought its own unique challenges. Whether it be from the services provided by the local health authorities or from a patient's own family, and sometimes a lack of, caring for a person in the time of their need can be seen as a moral obligation for all those who genuinely care. This short documentary will seek to highlight the challenges faced by the borough's BME communities, especially those from the Muslim faith, when accessing healthcare. It's estimated that Tower Hamlets has one of the largest Muslim populations for London, and the majority of this sizable demographic are from a Bengali ethnic background, which also represents about a third of the local population. Whilst there have been ongoing initiatives with engaging with the diverse needs affecting the borough's Muslim residents, such as providing information on fasting during Ramadan and campaigns to help quit smoking during the holy month, there are some areas which can sometimes be neglected or have been simply overlooked, which affects both Muslim patients and the wider community in Tower Hamlets. Research carried out by Eden Care, a charitable organisation assisting terminally ill residents, have documented the testimonies of both patients and their family members when accessing the local health services. Eden Care aims to present this collection of qualitative data in order to influence the decision-making process of Tower Hamlets' clinical commissioning group by highlighting the concerns raised in this report.
So her saliva doesn't go into her throat.
Almas and his wife are carers for their daughter, Mahima, who has been disabled since birth. Eden Care's Abu Mun visits Mahima's home and speaks with her father and asks him about the challenges that he and his family face.
What's her condition now?
My daughter will be 14 in August and she's diagnosed as 4-limb cerebral palsy. She's 24-hour needs care. Me and my wife have to take turn to stay awake at night time in case she chokes and she has epilepsy fit. And medication has to be done on the spot. If it's not done, then it can go wrong. So we have to stay awake throughout the night.
You are now, you're getting the right help?
Not really. I could do a lot more help. I could do a lot more help. The only help my daughter needs 24/7 care. 7 days a week throughout the rest of her life.
A lot of managers will be watching this.
Please.
What recommendations would you like to give them?
What can I say recommendation ways? Please, when a person goes into labor, take extra care and provide all the necessary information they need correctly in words they would understand. Simple words, basic word. It's not worth using doctor's code word. Will be no good to any dad really if they use code word TT4. What does it mean?
Only time I know my daughter understands something, her face would tell me.
Alma strongly believes that the lack of communication between hospital staff and his family were contributing factors to the ill health of Mahima on the day she was born. For Almas's wife, English was not her first language, and to compound matters even further, he also found their use of medical terminologies difficult to understand. Rushna shares a similar story of misunderstandings, as her elder sister Shupna had been diagnosed with an advanced stage of cancer, though the signs of its detection could have been noticed much earlier.
She's a mother of 10 kids, fantastic kids, alhamdulillah. She's given her whole life to bringing her children up. A very active member of the community, living around Whitechapel. So since probably about last May, she kept saying she had a lot of pain in her abdomen, and she went to the GP many times, and then the GP surgery kept saying, oh, it's probably nothing, or give her gastric tablets, and then they said it was kidney stones by end of summer, and then she was waiting on the waiting list to have her kidney stones removed. But then came along this GP who was a temporary guy, and he said, look, I'm very concerned as to you keep coming back to me, and he gave her for a CT scan. This was sort of just before.
That's the first one.
This is her first one, and this is nearly waiting for half a year to be seen for her kidney stones on the waiting list. And then this is just before December, and
December which year?
2014. And then they find out that actually she doesn't have kidney stones, she's actually got stage 3 cancer. She went abroad to Bangladesh and she got a herbal treatment, which obviously didn't work. I was against it, but when you're in that sort of a situation, you don't want to tell someone don't do this, because then in case if it goes worse, they'll point fingers at you. Just because, like I said, our knowledge of this, the whole cancer thing is very weak. So I think really the specialist should have taken that charge and said, look, we know what's best for you, and yes, we've made mistakes, but now we need to correct it. Within our local community, there is absolutely nothing to sort of approach the Bengali community, the people who are a bit hard, you know, who find English a bit harder.
Any positive experiences within the NHS that you have found now that your sister is in the hospital?
How can anything be positive when someone's being diagnosed on stage 3 cancer, and after nearly a year of being told it's kidney stones?
There could be a lot of support for her.
That the support could be there and that could make things better, but it's not there either. So
there's no support.
There's no support. There's no one's come forward and said, okay, the kids need to be need a bit of counselling or a bit of advice. No one's come forward. So, you know, our family, like I said, we don't know what to do for them. We feel like there are underlying issues with them now, and they're teenagers. They need to meet specialists and they need to let things out. Maybe that will help to speak to someone from outside rather than to a close auntie or an uncle, because they're very within our community, to express your feelings, it's just not the done thing. And I think young children want to express. We want to express, and I think if a specialist from outside came, it might actually be a lot easier for them to say, okay, how they feel, and just to accept and to start embracing what might happen. Really, my advice is, please, you know, you guys need to make an effort in this community, because there's people here that don't speak English, that don't know about Macmillan, that don't know about, you know, all these other cancers. You need something, like you said, culturally inclusive within the local borough to help people who are vulnerable and their families which are suffering in silence.
Rushna's heartbreaking story about her sister's health and the effects that it has had on her extended family highlights again the need for effective communication for all family members, especially when young children suffer because of the ill health of their parents. Abul Mir has a rare muscular condition that affects his ability to walk and has been wheelchair bound since the age of 13. Abul feels that his voice and other disabled residents are not being heard strongly enough.
I was able to walk, run about, but I used to fall sometimes, or and have struggle getting back up. I used to get assisted to stand back up again by family members or friends. But it was when I was 13 where I stopped walking and was wheelchair bound, because that's when I didn't have the strength anymore to stand up or to walk. Well, my experience with the NHS overall is okay. It's only until recently when I was admitted to hospital for the first time for pneumonia, which I found NHS, in particular Royal London Hospital, quite difficult, quite stressing moment, because how they was looking after me, they was looking after me like I'm a normal patient, but in fact I'm not. I'm a disabled patient, so my care and needs are different to normal patients, and I think they didn't understand that, and it felt like they didn't want me to understand that. They would leave me in a position on the bed and then tell me after 2 hours they would change my position, which for me it didn't sound fair because I'm not able to physically turn. So I would need assistance, but it's like they didn't want to understand that. They need to really understand how a disabled person is, what are their needs, the type of disability, and also when they get admission, they need to try to understand of the disabled person individually and what are their needs. Because in other healthcare out of Tower Hamlets, Like my specialist is in St. Thomas Hospital, the Lane Fox unit, and when I was admitted there was a really welcoming and pleasant experience. They knew exactly what they were doing. They knew my needs. They knew how to help me, how to assist me, and they will not leave me in one position for 2 hours. If need be, they will change me every 30 minutes if needs be, and they will provide more care. It's like they will treat you as a person, not just a patient.
In Abul's case, his comparison with the care provided between St Thomas's Hospital in Lambeth and the Royal London can provide an insight in how local NHS services could improve by following examples of good practice led by others close by. One of the inspirations for Abul Mumin to get involved with Eden Care was in the passing of his mother, Saleha Begum. Abul Mumin recalls some incidents that troubled him and his family whilst his mother was receiving inpatient care.
I'm sitting next to my mother's grave, Saleha Begum. She died on 13th of January 2013. She died because of heart-related illness. She's been a regular patient for 15 years with heart conditions in the Royal London Hospital, Newham General Hospitals. Generally, the service, the nurses and the doctors have provided, it's been incredible, and I really appreciate a lot of the hard work that they have put in for the care of my mother. However, there have been instances where I think things could have been much better. My mother was, she was on the 5th floor, or 4th floor, on top of the old A&E building. She, she wasn't well, and she was on lots of medication, and she needed a wash, and all the family members, we were there. And to our shock and surprise, 2 male nurses came to give my mother a full wash, and we were horrified, shocked about why her dignity and care wasn't a priority, and why these male nurses felt that they could undo the clothing of my mother to give her a wash. They could have been a lot more sensitive, I felt, and they really couldn't understand when we tried to explain to them, look, it's not appropriate. This is something is against her wish, against our wish. And the male nurses insisted that they were nurses and they could do it. They couldn't understand the pain that we were all going through. I mean, we actually had to stop them from coming and doing that. And I think with good planning, these kind of things could be really avoided. So I hope that the management of the Royal London Hospital or any other hospital really listen and take those cultural and religious needs and give it a priority.
Abul Mumin's account in the shortfalls of the care provided to his mother, where cultural and religious sensitivities had been overlooked, goes to show that there is still a long way to go in order to truly make our health services more inclusive for our borough's diverse needs. Community leaders, including the Imam of East London Mosque, Sheikh Abdul Qayyum, reinstate the importance of meeting the needs of the Muslim and wider community during their time of need.
What could the NHS, the hospital, do to accommodate the cultural and spiritual needs of the BME Muslim community?
I think it is something agreed by the society, wider community, in all levels, that it should be considered always in terms of the treatment, in terms of the dealing with the deceased and funeral process. Human society is in consensus, in agreement that the cultural, religious right should be fulfilled and should be taken in consideration of taking any decision, making any process of dealing any kind of transaction must be given priority, especially end of the life care, end of the life service, which is very linked to the religious and cultural things. No religion, no society can deny that this is one's last right in the life to get the religious cultural service according to his or her wish and desire.
Local councillor Abdul Mir also shares his view for the NHS to accommodate the spiritual and cultural needs of the local Muslim community and beyond.
Well, first of all, NHS must recognise that the BME community in London and across the UK need that kind of support and services. Yeah, in the past there's been a lack of recognition on this, and I think with a lot of demand and a lot of the community projects now realising that there is a big demand for this, NHS must first recognise this and then look at resourcing community projects that be able to go into partnership so that they can deliver these kind of services. You've got to remember there are a lot of Muslims who are actually suffering, those who don't have families, those are vulnerable members in our community, and it's across all different communities as well. But obviously there is a big section, you know, we've got the largest Muslim population living in London, and obviously the needs are great, and henceforth NHS must recognise this and look at ways how they can support that particular need.
Although there are many pressing health concerns that affect local residents, a recurring theme throughout our research has been a lack of effective communication between patients, their families and staff, especially where English is not a first language or not fully understood when spoken to because of the choice of words used. The language barrier can be overcome with the assistance from an interpreter and the use of simple English. All NHS staff should be proactive in providing access to interpreters at all times. Translation services for Bengali speakers should be promoted extensively throughout Bengali and Muslim media channels, including TV, radio stations and print media. This would help raise awareness for patients to use the bilingual services on offer and to feel more confident in using the NHS services independently. NHS staff should also be given culturally inclusive local training in order to understand Muslim sensitivities, especially when personal hygiene care is given by nurses of the same gender and not the opposite, as this can easily offend. This matter may seem unimportant for some, as nurses should be able to provide care regardless of gender. However, for most Muslim patients, receiving this level of intimate care should only be carried out by the same gender. If a Muslim patient is able to tick a box requesting halal food, then there should also be a provision requesting a same-gender nurse for seeking assistance with personal hygiene. Eden Care hopes that these small but significant findings will help create a more inclusive health service. Thank you for watching.